Okay, there's a lot of noise in the room. That's a good sound. But we got a couple more things to do before we say goodbye today. How were the breakout sessions? Good. Lots of good ideas I can see up here. I can't wait to read them all. And we'll try and turn them into some actionable ideas. But I thought just so that people, actually two things. One, somebody left a pair of sunglasses in Shenandoah. That's goal 4. No? Okay. Thank you. New pair of sunglasses for me. No, we'll hold on to them. If anybody knows anybody who lost a pair of sunglasses, let me know. Oh, are they? Okay. All right. Well, we'll get them back to him. So I thought, since obviously you only had the opportunity to participate in one goal, doing some brainstorming, that we just get some informal feedback from the facilitators in the different rooms, just to get a sense of what the other groups talked about. So why don't we start with goal 3, training. Would anybody like to share a bit of what happened? Yes? Kim, are you saying yes?
Invigorating. Thank you. Thank you. Thank you to the 21 people who joined the group. So we went through all 4 bullet points, brainstormed a lot of overlapping of ideas, really getting to workforce development, especially in the facilities, supporting leadership so that they can best support relationships and treat team members with dignity and respect so that they can have the same relationship with dignity and respect to people living with dementia. Anything else to add? Anything else to add?
Okay, that summed it up great. How about goal 2, data? Lana? Sure.
And anybody else who's on a group, please raise your hand. I'll pass the mic. But if I miss anything, but we had a great discussion with a real mix of service and researchers and data people. Also, we had 2 journalists in the room, so real, true interdisciplinary think tank. We addressed goals 2, which is the data, and 5, which is the research. There was a lot of discussion around getting micro data, so the statewide data. So right now we can get big picture level data, but how do we get state level data with the Virginia Memory Project kind of building up and could give us census level data by zip code. Then there was a lot of discussion about how do we get that data back to people and who. So not only the community, but back to the service partners, and how service partners can give that information back to us. So some sort of bi-directional information, but information that also matters or is personal. And I think those were the big ticket items. Did I miss anything? Andrea's standing there. I know. See. Okay. All right. Great. That's what I can remember from lots of discussion, at least. 2 and 5. Yeah, 5 was very similar. So there was some discussion, as you all know, we have our draft. So there was some discussion about how our draft recipients should be giving that information back in some way, in a lay manner, back to the community. And if we could create a platform in which that information, and have it somewhat mandated, that when they receive the information, that we help them break it down into a lay way that actually gets back out into the community, so that people understand when they're participating in research what the findings are and how they're contributing. So that was a big piece of what came out of the research. Oh, great. I bet there's going to be a lot of overlap between all the goals. So that'll be a lot of hard work.
Thanks, Lana. Okay, goal number 1, statewide coordination. Laura.
Thank you. So we actually had a smaller group, which I think worked really well because we ended up having deep conversations. Most of it focused on keeping people at home. So how do we increase caseworkers that serve families to help alleviate caregiver needs and keep people out of the hospitals? And one of the other things we talked about too is creating crisis centers specific to dementia families to try and keep patients out of being institutionalized, and then also increasing the AG rates. So a lot focused on how do we keep people home and how do we educate and keep them safe.
Great stuff. And then the last goal, care coordination or coordinated care. Oh.
I'll start. And Joyce, will you pick up where I leave off? So Joyce was our amazing scribe. And Dee, where's Dee? Is she still? Oh, Dee had to step out. So Ishan, Joyce, Dee, and I kind of coordinated. We had like 27 folks. Amazing conversation in there. We could have had more time to continue to brainstorm. Some follow-up, Laura, we were talking about some crisis support too. A lot around tailoring services for persons at different stages or phases of dementia, really recognizing and supporting the family caregiver, being more proactive in reaching out to families rather than expecting them to reach in for the services. What else am I missing? Tailoring. Joyce, I'm going to pass it to you because you summarized some things wonderfully. And standardizing some of our services. So we talked about memory care navigation, dementia care coordinator, patient navigator. It's confusing to the consumer, and maybe as a state we need to be centralizing and standardizing some of the terminology that we use and the services that folks have access to. But yeah, let's have Joyce kind of summarize things too.
Yeah, that's a great point. I know confusion is never helpful, so if we can get one name that everybody agrees on, that would be helpful.
That would be helpful. So you summarized, I think, very well, but I think the overarching theme to me was that we need to take care partners, people caring for someone living with dementia and the person living with dementia, and meet them wherever it is that they enter into our provider world, and come to them with a team and resources and a plan, and then we continue to come to them. And also, I just heard about reimbursement and need for training and need for all ages and all of those kind of things that would complete that team model if we could get that together. But I think the biggest thing was not making care partners find resources, but bringing the resources to them.
Yes, all great points. I'd like everybody to give a round of applause to our great facilitators and to yourselves. So we're going to, I guess I've got a lot of work now, so thank you. But I'm going to take all your ideas and I'm going to start to try to distill them into those actionable strategies that we can incorporate into the state plan. And we have a timeline of getting a first draft of the plan together by, I think it's June 12th is the next Alzheimer's Commission meeting. So we've got a busy month. And there is my holiday. And then we are going to take it back to you. So we'll have an opportunity for public comment. We will be letting everybody who attended the summit know how they can share some feedback on what we've put together using your ideas and how to make it absolutely the best plan that we could have. So our final deadline is, our final draft has to be ready for the commission meeting on September, I think it's 12th, somewhere around there. And once that's approved, then we publish it on the 1st of October. So we've got a quick timeline now and lots of things to do, I guess. But that's really great. That was the point of today. And thank you for making that possible.
We wanted to say that we actually had the additional one.
Oh, the brain health. I forgot the brain health. How could I do that?
So easily he forgets about us. I have to say, that we had an amazing group. We had, the room was full, which we're not surprised about, and we had a unanimous decision that brain health needed to be added to this plan. So the ideas that we came up with were amazing. We certainly want to align with other organizations. We want to look at bringing in youth. Rachel, come on up. Some of the other things that we talked about. Woo! But I just want to say, with all that we've heard for today and the past couple days about prevention, I think we would be remiss if we didn't add it. But so this is Rachel. She's the brain health coordinator, and let's tell them what else we said.
Thanks.
I said you're going to shine.
And the light is blinding. Literally shine. We had wonderful conversations. Thank you, everyone who participated in our breakout session. As Annette has mentioned, some of the things that we were focusing on is prevention and introducing those younger people into Alzheimer's disease and related dementias, and also working with outside of the health department and outside of public health agencies, so making those root community connections. That's all I got for you.
Lots of great information. Thanks, George. Sorry.
No, I'm sorry. Our whole day has been about brain health, and then I forget it. So, Rachel Coney, our brain health coordinator at Virginia Department of Health, she is making our Bold Act project happen in Virginia. So, I'm glad you all had a chance to meet her. So we have just a couple of other things on the agenda. First, we've got a little short video, which is a new documentary that's coming out. I've got a little text to introduce it. It's called Keys, Bags, Names, Words. So please enjoy the trailer of this forthcoming feature documentary. Unfortunately, we didn't have time to show the entire film. It's 80 minutes. But had we had a longer day, we would have tried to incorporate it. It presents intimate profiles of people living with dementia and their care partners. You'll meet doctors discussing what you can do in your life to support brain health and prevent cognitive decline. And you'll meet musicians and artists, scientists, and policy experts from around the world engaged in a bold approach to tackling one of the greatest global challenges for health and social care in the 21st century, dementia and brain health. This film is not a lament to loss, but a quirky and inspiring celebration of the human spirit. The film is set for release in fall of this year. You can sign up to learn more at keysbagsnameswords.com, and we'll send that out in part of our follow-up. So if you'd like to cue that video, and then I'll have a few final words. So I watched that several times so that I thought it wouldn't get me emotionally, but it always does. So I'm looking forward to watching the full film. So I hope you are too. Now for I got a couple more announcements, and then we'll have our closing call to action. But before that, just reminding everybody that we will have an evaluation for the summit. We'll send you an email, send you a link in your email. It'll be a REDCap online survey. Should take you 3 to 5 minutes to fill out. But we'd ask all of you to do that because we want to know whether you want to do this again, and we want to know how to do it better next time. So we appreciate your feedback. And then if you have any other thoughts or ideas, please let me know. We'll also be sharing PDFs of all the slides that you saw today. And both the plenary sessions, the morning and this one, will be, they're being recorded and they'll be available on the DAR's YouTube site. So you can share with all your colleagues who weren't able to be here today with us. And then get them to provide input into the plan during the next round. So thank you all for that, and thank you for coming. I'm going to turn it over to Karen Garner. She's been a member of the commission for 6 years, I think, maybe 7. And she is also the advocacy manager for the for Virginia for the Alzheimer's Association. So, Karen, you can do whatever you like.
Okay, well, I'll just stay down here then. Hi, thank you so much, George. It's really nice to be here. Thank you all for coming and being part of this. The only way change is going to happen is by us all collectively taking the time, the emotional energy, and making the effort to be here. So, as George mentioned, I am on the Governor's Alzheimer's Commission, and I also am part of the Alzheimer's Association, and I do the advocacy work here in Virginia, and I do it at the state level and at the federal level. So you may be looking at me and wondering how I got involved with the Alzheimer's Association and how am I involved with the Governor's Commission. So I'm going to ask, not if you already know me and have heard me speak before, you're not allowed to answer. But how many of you think I am involved because of my grandparents having dementia? What about my parents? How many of you think it's because of my parents? What about my spouse? That's right. So, actually, now it's been about 13 or 14 years ago, I started noticing that my husband wasn't himself. He was retired Air Force. He was really smart. He could take apart things, put them back together, and I knew him. We'd been married for, at that time, about 12 or 13 years. We had 2 kids. They were pretty little. And one day we were driving down the road, and one of the kids from the back seat says, how do they determine what the speed limit is? And before I could even answer, my husband said, based on the number of potholes. Okay, so as most of you can imagine, my initial response was, no, it's not. What is wrong with you? And we proceeded to have an argument driving down the road. A simple question from one of the kids turned into an argument. But he, for some reason, was just hung up on the fact that the speed limit was based on the number of potholes. And I was hell-bent on my kids were not going to go to school and tell their friends that the speed limit was based on the number of potholes because they were going to look like idiots. And what if they said their dad told them that? So I just didn't know what was wrong with him. Something was wrong. We went to marriage counseling, and we must have been the most frustrating couple because we'd go in, and I would complain about him and all these things he was doing wrong, and he would sit there and say, yep, she's right. I'm going to do better. And he wouldn't. And we'd come back to the counselor and would repeat over and over again. And we eventually stopped going. 2 years of test. 2 years of dealing with the marriage that I didn't know what was happening. I mean, that's longer than most Hollywood marriages. Let's see, how many Kardashian marriages would 2 years be? Then one day, he called me at work. It was a different nonprofit. And he said, guess what I'm looking at? I said, I don't know. What are you looking at? He was in Savannah, Georgia. Keep that in mind. He said, I'm looking at that bridge that we crossed last week. I said, we were in Beaufort, South Carolina. Yeah, that one, I'm looking at it. I said, aren't you in Savannah? Remember, he was a senior master sergeant in the Air Force and had lived all over the world. Again, we proceeded to have a huge argument because he couldn't grasp being in Savannah, Georgia was not the same as Beaufort, South Carolina. Now, the bridges do look alike. Any of you guys have been to both of those suspension bridges know. I hung up the phone, And I started bawling, and I left work. I couldn't even talk. I knew. So fast forward, he progresses. We finally get a diagnosis. He was the first patient at Riverside Hospital to have a spinal tap test. I had read about it somewhere in an article, and I had talked his neurologist into having that test. So then it was confirmed. Well, guess what? His mom had also passed away from younger onset Alzheimer's, and about that time, his brother was getting diagnosed. So before he passed away, I did have him tested. And he did have a genetic marker. And each one of our children have a 50-50 chance of having that same Priscillin 1. So I joined the commission. I came to work for the Alzheimer's Association. Normally when I'm talking like this, I'm going to ask you to reach in your pockets and your purses and write some checks or make a donation. So you're lucky. This one, I'm not asking for any money. So only when I'm raising money. But what I am going to ask you to do is to carry this energy and carry this knowledge and this passion that you have brought with you today, and maybe that you have learned some things today. And I am begging you. I'm begging you for my kids and their kids, because both of my kids don't want to get married and they don't want to have kids because they don't want their children and their spouses to go through what they went through. And I am terrified that about the time I'm old enough to retire, if I ever get there, I will just be taking care of my kids the same way I had to take care of my husband. And as I sit and I listen to all of our plans, Lana earlier talked about data and information. But behind every piece of data that we have, how many people in Virginia have dementia? How many caregivers are there? How much money are those caregivers not making? How much are they spending? We have all of this data, and we have all of these numbers and all of these stats. But behind every single one of those numbers is a story just like mine. It is caregivers that don't know how they're going to make it through the rest of that day. It's children losing their parents or their grandparents or their siblings. And that's a human story. It is not a number. It is emotions, and it's heartache, and it's damage that you cannot imagine long-term to families. And what we have to do as a society is not stay quiet. So over and over again, I hear from people, yes, my grandmother had it, my sibling had it, somebody, my neighbor had it, a coworker had it. But they never talk about it. They never talk about it. Even people that work in the dementia field really don't talk about it. It's hard. It's hard to talk about. It's hard for me. My husband has been gone for 7 years, and I am still emotional about it, because when you go through Alzheimer's and dementia, any kind of dementia, it is draining emotionally, and it affects you physically that you can't even imagine. So what do we have to do? It's more than coming up with ideas. It's talking to your legislators and demanding this be part of our budget. That's what I do for a living, and I work with advocates. And I can't tell you how many times I have people say, oh, I can't do that, I can't do that. Well, guess what? You can do that. All you have to do is share your story. All you have to do is tell them you are their constituent and you want this to happen. This is what's important to you. Because if it's important to you and you're the person voting for them, it will become important to them, especially if we have enough people. Do you know how we got a polio vaccine? Our government supported research and our government demanded that our scientists find one because everybody was scared they were going to get polio. AIDS, you guys remember AIDS? They were marching in the streets. People were terrified. How did we get help for AIDS patients and HIV patients? The government stepped in, and at that time, an ungodly amount of $1 billion. Do you know how hard we've been fighting to get to $2 billion? When my husband was diagnosed, we got less than $500 million in research funding from the government to the NIH. We're now at just over $2 billion. That's about 13 years of going to DC and demanding that we have this research. And we're the only disease in the top 10 killers that don't have a treatment and a cure. So, how can you make a difference? Think about what we've talked about. How in Virginia can we integrate information so when somebody does get a diagnosis, they know to call the Alzheimer's Association or Hilarity for Charity. They know they need to get a diagnosis. They know it's important not to ignore those symptoms. They know where they can go to in their communities around the Commonwealth to say, hey, I'm seeing these symptoms. I need a diagnosis so I can participate in these opportunities. These opportunities to participate, like was just mentioned, participate in clinical trials, diagnostic trials. My husband was too young. So when he was diagnosed, he was in his mid-40s. He passed away at 53, right before his 54th birthday. And at that time, I went to clinicaltrials.gov, and I searched and searched for a clinical trial for him. He was too young because there's limits. So we did get him in a diagnostic study. So if you can spread the word about clinicaltrials.gov and getting people to participate, please do. If you can talk to your legislators and tell them that you demand these programs, you demand this funding, you demand research, you demand support for families, respite care. You know, when it comes to dementia, it's not just getting a diagnosis, going to the doctor, and then going home and waiting. When my husband finally did, after imagine 2 years of trying to figure out what was wrong, we finally get a diagnosis of mild cognitive impairment with the possibility of going into Alzheimer's. I had no idea what that entailed and what that meant. I just thought he was going to start getting lost and lose his keys. Maybe forget some names. I looked at the doctor, I looked at this neurologist, and I said, well, what do I do now? He said, I don't know, I'll see you back in 6 months. How many times have we heard that same exact story? That's my story, but it's probably 95% of the other people, how long it takes for a diagnosis and what happens. He didn't send me to the Alzheimer's Association. I found them online. He didn't tell me there was a agency on aging or DARS or anything else. They don't know. They don't tell you. But that's where you're going to get the help. So please, carry this passion. Spread the word. Demand that the people who can make these decisions will do it. Because that's the only way all of this is ever going to happen. That's the only way we're going to be able to have our children have support. That's the only way when it's our turn to get those diagnoses, our children will have that support to help us. Because none of us want to be a burden. So right now, please make that commitment to spread the word about all of our programs and demand that we get this help. Thank you, George, for having me. Thank you guys for being here. And if you're not familiar with all of the programs that DARS does, I know we've been going over it, but please make yourself aware and get out there and spread the word wherever you can. Thank you.
I don't have the words to follow that with anything except thank you for coming. Thank you so much, Karen, for sharing your story. It's always so inspiring and difficult. It's a difficult story. So, thank you for sharing it. You've heard Karen say what we need to do. We need to get out there. You need to tell your folks that you're working with to share their stories, share the stories with the people who make the decisions about how our taxes are spent. I don't have anything more to say. Thank you so much for coming and making this such a great day.